Today I'll be talking about structure and function of the scapula and the muscles that act on it. The information that I'll be talking about is covered in two labs, musculoskeletal 2 and musculoskeletal 3. The learning objectives that I'll discuss are identifying individual skeletal structures externally and describing how muscles' attachment points and fiber direction determine their function. First, I'll discuss the scapula, and in this picture is the posterior view of the right scapula. So I'll just label the structures on the scapula. So this structure over here in blue is the medial border. The structure in green is the superior border. This structure in orange is the lateral border. And the lateral border leads to a depression in the scapula, which is called the glenoid fossa. So also right under the superior border is the spine of the scapula. So that's in that kind of pink color. And the spine leads to the acromion process, which is going to be outlined in white. So that's the acromion process. So each of these structures is important because they serve as scaffolding for the muscles that attach to it, and that will lead to the muscles that I'll talk about that actually act in the scapula. So the first one I'll talk about is the levator scapulae. So in this image is the posterior view of the skeleton, and the superior or medial attachment points for this muscle are the transverse processes of the C1 through C4 vertebrae. So that's in this pink box. And the inferior or lateral attachment points are the medial border of the scapula. That's highlighted in orange. So another thing that's important to mention are the striations of this muscle. So the striations of this muscle are vertical, and that's important because striations determine the function of the muscle as muscles contract in the same direction as striations. So since the levator scapulae has vertical striations, that will cause the scapula to elevate. So that would be the function of the levator scapulae, would be the elevation of the scapula. And the next muscle I'll talk about is the serratus anterior. So on the left, it's a picture of the posterior view of the skeleton, and on the right, it's a picture of the lateral view of the skeleton. So the medial attachment point of the serratus anterior is the medial border of the scapula. So I'll outline that in pink. And its lateral attachment points is ribs 1 through 9. So I'll highlight that in orange on both diagrams. So on the lateral view, the medial border would be right here, and then the ribs would be right here. So for the serratus anterior, the striations are horizontal this time. So that will cause the muscle to protract, or cause the scapula to protract. And that is the function of the serratus anterior, which is to protract the scapula. So the last muscle I'll talk about is the trapezius. So the trapezius is split up into 3 different parts, which is the superior portion, the middle portion, and the inferior portion. So for the superior portion, the medial attachment points are the occipital bone and the C1 through C6 vertebrae. So I'll outline that in pink. And its lateral attachment points is the medial border of the acromion process of the scapula. So I'll outline that in green. So right here. So below the superior portion would be the middle portion. So for the middle portion, the medial attachment points are the spinous processes of C7 and T12T3 vertebrae. So I'll highlight that in blue. And so the lateral attachment points for the middle portion is the upper border of the crest of the scapular spine. So I'll highlight that in purple. So right here. And so the most inferior part of the trapezius is the inferior portion. So for the inferior part of the trapezius, the medial attachment point is the spinous processes of T4 through T12 vertebrae. So I'll outline that in yellow. And its lateral attachment point is the same as the middle portion, which is the upper border of the crest of the scapular spine. So I'll just circle that again. So they have the same lateral attachment points. And so for each section of the trapezius, there's different patterns of striations. So for example, for the upper portion or superior portion, the striations are diagonal. And that causes the scapula to elevate and rotate superiorly. And then for the middle portion, the striations are horizontal. That causes the scapula to retract. And then lastly, for the inferior portion, the striations are perpendicular to the superior portion. So the scapula retracts or depresses and rotates inferiorly. And the sources I used for this presentation are all here.